The budget 2022-23 has come under some criticism for not maintaining the recent increases in health allocation. The figures need to be placed in perspective. The budgetary outlay of 83,000 Indian rupees crore for 2022-23 is 16.5% over the budgetary allocations for 2021-22 and 0.1% over the revised allocations of 82,920 Indian rupees crore for the current fiscal. The revised estimate reflects a one-time COVID vaccination cost, which is likely to be considerably less in the coming fiscal, as over 75% of the eligible population is fully vaccinated. A 16.5% rise over the B for this fiscal is a more realistic comparison to make. While it can be argued that this hike is inadequate in relation to health infrastructure needs, the fact is that central budgetary spends towards health have more than doubled since 2014-15, when 30,626 Indian rupees crore was spent. That said, a flat outlay of 6,412 Indian rupees crore for Ayushman Bharat for 2022-23 is a disappointment. The 15th Finance Commission echoes the National Health Policy 2017 to assert that public spending on health should account for 2.5% of the GDP, 1% by the center, 1.5% by the state. The Economic Survey 2021-22 observes that in keeping with the NHP's goal of 2.5%, central and state governments' budgeted expenditure on health reached 2.1% of GDP in 2021-22, against 1.3% in 2019-20. Total expenditure by the center and states has increased from 2.43 Indian rupees lakh crore in 2017-18 to 4.72 Indian rupees lakh crore in 2021-22. However, this spike could largely be on account of the COVID emergency. This level should become a norm, as enshrined in the NHP. The World Bank, however, points out that higher devolution under the 14th has translated into social sector spends by states, a trend that should continue under the 15th period till 2026. The NHP mandates that states should spend 8% of their outlays on health, against just over 5% at present. As for the center, its budgeted outlay for 2022-23 is just 0.3% of GDP, a pre-COVID level. Health spending is about lifting all boats and looking beyond the central budget. The focus on allocation should be accompanied by an emphasis on design of schemes, implementation and outcome. That outlays do not always translate into great outcomes are borne out by the fact that forward states such as Andhra Pradesh, Telangana and Maharashtra spend below the national average of 5.18% of GSDP, whereas Jharkhand, Chhattisgarh, Odisha and West Bengal spend above the national average. Serious concerns, for instance, have cropped up over accountability in a number of central and/or state schemes, where the auditing has been outsourced to private entities and details do not figure in official documents. The proliferation of schemes has led to lack of accountability. The 15th emphasis on developing primary healthcare centers, with targeted grants to the local governments, should be accompanied by a participatory audit system in place. Health spending must be viewed through a qualitative lens.